Hi, I'm Elizabeth Hess. I'm here with Julie Pryde. She's the administrator of the Champaign-Urbana Public Health District. Julie, there is good news, there is bad news. Let's start with the fact that Champaign-Urbana is not in the first wave to receive vaccinations. How was that decision made and why?
Well, I think that first of all, that decision is still being decided. I don't think it is set in stone yet. They're still working through a lot of things. I think that what they originally tried to do was send it to the places that had the highest death rate, basically, but that doesn't really seem to make the most sense, especially since some of the counties don't have hospitals and their residents are having to come to larger places like Champaign-Urbana to get treatment. So they're looking at those again.
Let's talk about the vaccination phases, and correct me if I'm wrong on this, but the first phase will be frontline health professionals, nursing care workers, nursing home. Is it possible that the US will still be in phase 1 in March because of the sheer numbers, or will we be able to move into phase 2, which is people over 60? How is this going to roll out?
Well, it all depends on mostly how much vaccine each place gets at what time. But I think that we're assuming that phase 1 will be done within a month or so of them starting to ship out vaccine, assuming that we start getting decent amounts. But we know how many people need to be vaccinated, and within each of those places, they have further prioritized those most at risk. And so, I mean, we're ready to go. We just need to get the vaccine in hand, and we're all ready for that. They're anticipating between the 11th and the 15th, the first vaccines from Pfizer are going out, and then around the 22nd, the first vaccines from Moderna will be coming out. So, and hopefully after that, they'll just keep rolling out. But I know originally Illinois was promised a lot more vaccine than we're getting, and I haven't really heard what's changed with that. But the national plan needs to be equitable, and it needs to be not based on politics. So I hope that in no way plays into this. But right now, all until we have it, I can just tell you that all we can keep doing is reworking our plans every time we get something new out. But we were surprised that the state put out information about the first 50 counties getting it. That I don't even think that was a good idea, because like I said, it's not really even finalized yet.
So if I am not 65, I don't work in schools, I'm not a healthcare worker, the way I read the data here is that it could be May or June before the last set is qualified. Am I reading that correctly?
Yeah, that's probably likely. I mean, we're anticipating, again, it's all based on just kind of what we know, which is changing every hour, but we do look for there to be hopefully enough vaccination in our community by summer to make sure that everyone who wants it and hasn't already had it will have access to that.
In terms of numbers here in Champaign County, have we seen the spike? Are we on the other side of it from the Thanksgiving holidays? Where are we right now?
Well, right now we are at we've had so far total cumulative 11,795 cases. Right now we have 1,001 active cases, 1,418 additional people in quarantine. We have a 7.4 positivity rate, which is certainly better than it was just a few weeks ago. We have 20 Champaign residents who are hospitalized and 75 hospitalized locally total. So, I think that from what I heard, a lot of people really did alter their Thanksgiving plans, and we're very grateful for that, because that is showing up, somewhat in the numbers. But we are, what we're still seeing are the same things, gatherings, weddings, things like that, and those are causing a lot of problems.
Nationally, in the first 5 days of December, we accumulated 1 million cases. So while we're doing better here in the county, Illinois is doing its best. Where are we going wrong?
They're going wrong in a lot of places by simply not following the science, not following the guidelines. The guidelines are made for a reason, and it's to prevent, like I've said a million times, to prevent the hospitals from becoming overwhelmed, because that is really the concern. It's also a concern that people are getting infected, and many are dying across the country. I think the numbers are staggering. That we're seeing these numbers from something that is preventable, and yet the case numbers, as you see, it's exponential growth. It just keeps shooting up, and it takes a while. I need to remind people that it takes a while for the hospitalizations and deaths to show up from an event. They don't usually get infected and then boom, they're in the hospital, unless apparently you're the president or Rudy Giuliani. But my guess on that is that Rudy Giuliani was actually probably infected earlier, because normally it takes a while for them to get sick enough to go to the hospital. So.
And not everyone who gets sick gets the level of care somebody like a Rudy Giuliani could.
Correct. Or even, has access at all. We're super lucky in our community, but that's not the case everywhere. And they're starting to see in rural areas what years and years and years of neglect of their healthcare system, what that's leading to. So they don't have, they have people without access to care, without hospitals around, because Medicaid has been slashed in so many places that a lot of the rural hospitals are gone. Healthcare workers just aren't there. So, it's not a good place to be as a country. But we still have, just because Champaign County is doing, holding our own, if you will, that's not the case in a lot of parts of the country. And it's just, it's staggering, the numbers. It really is.
The vaccine has not been tested on children under 12. Mm-hmm. If somebody came to you, Julie Pryde, or as administrator of CU PhD, either hat that you wear, would you tell them it's okay, you should vaccinate your children with this?
Well, first of all, they can't be vaccinated until it has been approved. So it will go through the studies, and this is very typical of how vaccines how the phase 3 studies are rolled out. It usually starts with, adults, relatively healthy adults, and then it moves on to other populations, children, pregnant women. So it's not unusual, but by the time kids are eligible for it in the rollout, it will have already been tested to prove that it's safe in that group, and the efficacy is high as well. So as long as it's coming through ACIP or the CDC, FDA, I will absolutely tell them that it's good to go, and I would vaccinate my kids as well, assuming it comes through that. But luckily, now, if this had been like H1N1, they would have started, backwards. But this definitely impacts older people much more severely. It can affect anyone, as we've seen, but it really, really is hard on older people.
So do you suppose school districts will listen and wait before they rush to put teachers and administrators and children back in the classrooms after the holidays?
Well, I think we'll be looking, each county will be looking at their local numbers and seeing where things are going and making suggestions based on that. And a lot of it's going to be based on the individual school and their ability to maintain social distancing and masking within the schools. Because if that can continue, then that makes it a lot safer. While
we haven't overwhelmed our healthcare system yet, do you think that not enough is made of or talked about with how overwhelmed doctors and nurses and healthcare professionals are anyway right now?
Yeah, it's bad. As hard some days as is to get up and come in here, for me and some of my staff, we are not going in 12-hour days in full PPE, working with clients in just a horrific situation, and we're definitely seeing that all over the country. The healthcare workers are being exhausted and burnt out, and they are beyond sick of the harassment and the the denial and the bizarre, behavior that's going on out there. It's very, very wearing on them. So yeah, it doesn't have to do with how many beds you can cram into a facility. I mean, we have ample facilities all over and beds to put in there. And it's not just beds and ventilators and equipment. It is who can run that? Who do we have that are trained staff to run that? And I like to keep reminding people that during a pandemic, we're all in the same boat pretty much, especially after the first wave. The first wave, everybody was coming from all over the country to go up and help in New York. There's no one coming to help anywhere else. There's no one else to come. This is a pandemic. That means it's happening worldwide, and there is no help out there.
Let's talk about the vaccine one more time. Let's talk about the fact that when you get it, then you wait 28 days. So you prepare your body for it, and then 28 days later, it's kind of a booster shot. People say that they have had mild side effects. That feels like you have the flu. Is there anything that you say to people now that if they're afraid of getting a new vaccine that no one else has had before, that they will have symptoms? Or people always come to you and say, I can't get the flu shot, it gives me the flu. Are you going to say the same thing about COVID?
Yeah, even though it's a completely different type of vaccine, all the people it's been tested on so far, it's come back as mild. It feels like you're getting a flu shot, and you'll have a sore arm, and some people may have a little fever afterwards and feel kind of generally achy. So I am sure that when people get the vaccine, their healthcare providers will be suggesting the same thing they do after they get a flu shot. Take an Advil or some type of pain reliever to help lessen the soreness and stuff. But it's not, it cannot in any way give you COVID, and it cannot, it does not alter your DNA in any way. I've heard that type of thing. That's just not how it works. Just like there is with vaccines that have been proven safe and effective for decades or generations, there will still be people who won't take it. And that's the kind of thing where we're just not going to keep banging our head up against the wall on that one. We are going to be getting the vaccination out as fast as we can to the people who need it the most and who are willing to take it. We're just, we'll put out as much information as we can, but we all know that some people will not be convinced, and no amount of science or cartoons or puppet shows or anything else is going to convince some people. So, well, that's just what we'll have. And I look for that to be less of a concern, certainly in our county and we've shown a really high rate of vaccination in our county usually. So I'm less concerned about it here than in other places, but this is where I need to be concerned about. So
one more question about the vaccine, and that is that there are temperature requirements for the vaccine to be stored. Do we have that capability here in the county?
We have a lot of that capability in the county. CUPHD, when we very first heard that the Pfizer vaccine was, and well, actually a couple of them at the time, were going to require that really low refrigeration, freezing, we ended up going out immediately and purchasing that freezer for that. So we have it here at Public Health. The hospitals have it, pharmacies may or may not have it. I don't know exactly what all of them are ready for, but yeah, we're ready. We've been ready for a lot longer than the vaccines have been ready. So we have the space, and like I said, Carl and OSF are good to go, and we have a lot of extra backup, of course, should we need it, because of the U of I and all of their vast resources that they have on campus. Just because that's abnormal for public health departments or pharmacies or clinics to have that type of storage, it's not unusual to have those types of freezers for other settings.
Last question before I let you go. Your job and your staff, your life would have been much easier if there had been an organized national federal response to this. President-elect Joe Biden says that he will put in a 100-day mask mandate after he's in power. Is it too late if we start this late January, or will that actually help?
Oh, it would help if anybody started doing it at any point. That's going to help. Because they work. I mean, that is just the reality of it. Masking and distancing works, but you have to do it. So, you know, unfortunately, I think we're in this just bizarre place in our country right now where half of the people just refuse to wear masks for a variety of reasons, and the other half are wearing them. So, you know, I think we're going to, whether there's a national mandate or not on masking, I think that we're going to see a lot of the same patchy mess that we're seeing now, spotty, you know, response, and that is a lack of leadership at the federal level. That was a huge bungle, and that will be studied forever. That's going to be in every single infectious disease and public health textbook and sociology textbook going forth for a long time, because it's bizarre. That's all I can say about it. It's bizarre and it's very unhelpful, and we are absolutely reaping the benefits, or the lack of benefits of that. We are reaping the destruction from this response. You can look all over, you know, the world at how other places are doing, compare them to us, and you'll see that we should not be anywhere near this level of infection or death or economic, you know, crushing economic problems. It's all tied to the virus. The virus is what sets a timetable. And if we refuse to do the mitigation strategies, then it just drags everything out longer and makes the pain go on longer and longer.
Thank you, Julie Pryde. I want to thank our masked producer, UPTV producer, Jason Liggett. We are lucky to have Urbana Mayor Diane Marlin. Thank you for letting us continue to do these updates. Julie Pryde and her entire staff, you are the administrator of the Champaign-Urbana Public Health District. This community is really, really lucky to have you. Thank you so much.
I'm really, really lucky to be in this community. I can tell you that.
Stay safe.
You too. Thank you.